Your NCLEX patient has sudden, severe pain with silent bowels. What do you prep for? Answer at the end. Let's review bowel sounds. Normal sounds are high-pitched and gurgling every 5 to 15 seconds. Hyperactive, diarrhea or early obstruction. Hypoactive or absent, post-op ileus, peritonitis, or obstruction. And never call them absent unless you've listened in all 4 quadrants for a full 5 minutes. And your patient with severe pain and suddenly silent bowels. Prep for emergency surgery. Subscribe for more NCLEX prep, because yes, you can!